With the coronavirus outbreak taking over daily life, here are some do's and don'ts when it comes to prevention methods like social distancing or self-quarantine. Assuming you don't have COVID-19, aren't showing symptoms, or have not come in contact with an infected person, let's start with a bare minimum step, and that's social distancing. Albert Coe, the chair of the epidemiology department at the Yale School of Public Health, tells The Atlantic that when avoiding large public gatherings, think about skipping bars or restaurants where people are packed together. When you're out, he suggests getting a 6 to 10 foot buffer zone from others. Self-monitoring is the next level, as Walid Javed, the director of infection prevention and control at Mount Sinai in New York City, tells MarketWatch this step is really just being aware if you have coronavirus symptoms or if there's a concern that you were exposed to it. If you start experiencing symptoms, he says that's when it's time to see a doctor. Next is self-quarantine, meaning you voluntarily isolate yourself and do so on an honor system. MarketWatch says that means following guidelines from the Centers for Disease Control and Prevention, like staying at home and isolating yourself generally for 2 weeks. If you live with others, this also means isolating yourself within the home as much as possible. This means you're not leaving the house unless you're going to get medical care. And if you're receiving packages or food, ask the delivery person to leave it outside the door.